Good morning, Dr. Bhonsle here from Fortis Hospital, Mulund. We'll talk today about Bunion. Bunion is something which is a foot deformity. We in our orthopedic technical language call it Hallux Valgus. Hallux means the big toe. Valgus means it's an outward deformity. It's quite common. There are 2 or 3 main reasons for that. Some people are born with a bent big toe. It's known as Bunion. So sometimes it runs in families. Otherwise, it can be acquired because of rheumatoid arthritis, that is arthritis of multiple joints where feet as well as hand are affected. Second reason for that is ladies, as they approach middle age, there is a hormonal change called menopause, and that can be associated with foot deformities, especially in those who wear high heels and tightly crowded shoes. So what happens in Bunion is, as you will see in picture, that the big toe is bent outwards. Sometimes it gets bent outwards so much that it crosses the second and third toes. And that is when we start thinking about any surgery. Majority of the patients who have Bunion tolerate this deformity well. However, because the big toe is bent, their footwear gets spoiled quite often and it develops a bump from inside. That's why they don't like it, because their shoes and their smart shoes get spoiled. However, mild to moderate Bunion deformity usually is not painful and does not need a surgical correction. It can be managed by certain splints, as you will see in the image, that there is a corrective splint which can be worn at night, and they have to wear loose shoes rather than tightly crowded shoes and very high heels, which make the Bunion deformity worse. A moderate or severe Bunion deformity, when it's painful or when it looks very unsightly and when it's crossing over to the other toes, can be surgically corrected, where we cut the bone and we then put a screw in the bone which is surgically corrected, and the foot becomes completely straight. Usually this deformity is in both feet. It's not unilateral. So if a surgery is required, it's required for both feet. When we do the surgery, we surgically correct the bent toe and put the leg in plaster for about a month. After that, the deformity is permanently cured. Thank you.